My name is Andrew Lai, and I specialize in internal medicine. Listening, very important, I think, sort of both directions. I think listening so that I understand what the patient is looking for and what their needs are. And at the same time, they should be listening as well, so that the best possible outcome can be obtained. If they listen and that develops or promotes a trust in between you and the patient itself. So I think once you get that trust, I think a lot of times the outcome tends to be better. And therefore, I know what you as a patient want. The patient doesn't walk out of the experience or the clinic appointment saying, I don't think I got what I needed from that appointment. And so there's a lot of dissatisfaction involved in that. So satisfaction in knowing that you got what you needed, and from a medical standpoint, knowing that I gave you what you should be getting as well. Well, the primary care physician is probably the doctor that's going to know the patient the best. So, and as you develop the relationship where the patient comes and sees you regularly for small things, then you build that sort of, as a physician, you build that sort of understanding of how a particular patient has their history and illnesses that they've undergone. So, as opposed to somebody who doesn't have a primary care doctor and goes to several different doctors, you're sort of getting someone who doesn't have the knowledge about a particular patient. And so from a treatment or diagnosis, it tends to be a little bit off, either undertreated or overtreated, and never quite is right. And so that's why the importance of the primary care doctor is so that you try to get close to the right treatment and not to overtreat or not to undertreat. And in terms of medical care, I think that's the best. At the end of the day, I think it's the fact that I made a difference in someone's life, a positive difference, that in their time of need, so to speak, or their time of illness where they're looking to have someone help them out, that I was there for them. That's probably the bottom line for me.